More than 275 people in the world suffer from an anxiety disorder, the most common being GAD, generalized anxiety disorder. On the other hand, 19.3% of the whole Colombian population reported having experienced a generalized anxiety disorder or attack at some point in their lives. Usually, these types of disorders are more common in academic environments, especially in the university space, where people are exposed to high levels of stress, besides being immersed in a space that involves constant social interaction, in addition to an exposure to different situations that can create traumas or even a sense of nonconformity. Furthermore, according to the National Ministry of Health, during the last decades, there has been an exponential growth of anxiety in the younger generations, aged 18 to 29 years old, with a percentage of 17.76%. According to this, in the Universidad de los Andes, there are 14,243 students, of which 63% reported an anxiety disorder or any disorder related to a mental illness. The situations that can cause anxiety in students within the university context vary depending on the person. However, among the most common are academic pressure, uncertainty about the future, integration problems, traumatic experiences, among others. This is a regular student at the Universidad de los Andes, diagnosed with generalized anxiety disorder. We observe their behavior on a daily basis where they face different situations that increase their stress levels. Not only does the work corresponding to each subject overwhelm them, but being introvert, they find it difficult to interact with new people, which make them insecure and makes them victim of constant anxiety attacks. This causes them to sweat excessively, not only on the palms of their hands but also on their forehead, which in their imagination makes them look like an easy target to strangers. In this way, they look for a way to calm themselves down by hiding in their coat, as well as looking for places they are not alone while they sneak among the people in the corridors. Their head only makes them think that they are making a fool of themselves, in addition to feeling insecure about themselves, which makes them look for a way to flee from the environment in which they are. As a solution, a patch was born out of the need to create a fast and accessible alternative as a treatment for anxiety attacks. It was created as a solution to which these people can resort when they find themselves in an environment in which they do not feel completely safe, to create a sense of tranquility and comfort for their well-being. This alternative is composed of a series of patches whose objective is, through biosensors and sensory stimuli, to simulate a quiet space to create a sense of security for patients while they are in spaces where interactions increase their stress levels. Our users are defined by university students who have this condition and can be immersed in these situations while in the academic environment. This solution is portable, which makes it an accessible alternative at all times, so that through the levels detected by the biosensors in patients with an anxiety attacks, the patches will begin to work together to provide a safe treatment for patients in the shortest possible time, thus seeking their well-being at all times. This system is mainly composed of 5 patches, a main patch consisting of a biosensor that allows measuring changes in cortisol levels and sweat. This patch is interconnected to another 3-patch system that, upon receiving the signal emitted by the biosensor where it perceives drastic changes in these levels, activates its operation. Each patch is activated at different degrees of anxiety, allowing the person to adjust and respond to certain stimuli depending on the degree of the attack they are facing. The patches are intended to mitigate and control the symptoms of anxiety through sensory stimulation therapy, like texture, smell, temperature, and compression. Symptoms and responses to stimuli will be monitored through a mobile app, which will receive all possible psychological changes and data that the biosensor can detect in the person. This will make it possible to identify those components that help as catalysts of the attack, so that new stimuli that the person may need can be adjusted or formulated. This in order to carry out a more specific control of the symptoms and, in the long term, to be able to generate better complements to psychotherapy. To develop this process, it will require not only the involvement of the patient, but also of the attending psychiatrist who is aware of the situation that this person is going through. This is because the app will use control information for the creation of reports and data that will be sent to the specialist to keep track of the patient's real state. In addition, the university will be expected to support the use of this alternative. since it is in its interest to maintain the mental health of its students in good condition, while creating a safe space that generates well-being for them. This alternative will be developed for clinical and psychotherapeutic support to patients with GAD, adjusting the use of the device to the needs of the person within the therapy sessions and subsequently to its daily use. For this, we intend to develop alliances with different physicians in the areas of psychology and psychiatry to implement this system with the aim of offering an effective solution for those who need it. With this in mind, the physician will play the role of promoter of the product so that the patients know about it and identify the benefits it can bring. These devices are designed as an electronic and portable daily use technology. For the development of these elements, we focus mainly on technology and medical equipment that ignore some aspects of human behavior, such as the emotional factors involved in using a medical device on a daily basis. Biosensors and electrode technology is key when designing an unobtrusive medical instrument and equipment, having as little influence as possible on the patient's daily routine. Human body is made up of different points, according to the bioenergetic medicine, in which different stimuli can be performed to create a sense of tranquility depending on the severity of the attack that the person is going through. In this way, it is proposed that the size of the product is determined by the technical components given by the type of patch that is being made. Likewise, the patches will be placed on different parts of the body, using an adhesive material that allows the creation of a durable and easily accessible solution. Additionally, the system of which the series of patches is composed requires few operational and maintenance resources so as not to generate additional costs. Likewise, the proposal allows expanding and scaling the scope of this system, since it could eventually be considered the opportunity to replicate the threat, monitor and control other types of disorders such as stress, autism, among others. The objective of this alternative is to contribute to the fulfillment of the third SDG, which corresponds to health and well-being. It is proposed that the part of the structure of the product has a prolonged use, so as not to create a feeling of discomfort in the patient by having to be constantly changing it, in addition to creating a lower environmental impact. As well, the adhesive that surrounds the sensor will have to be replaced with a certain frequency, although it can be used in the presence of water so that users can make use of it more frequently, without discomfort or worrying about changing it daily. After this, there will be a material reuse process for the patches already used, with the objective of not creating a large amount of waste, while taking advantage of materials in the patches that can be used again. With the use of this alternative, we understood the limitations we face with technology, given that it can be used so that users can be affected if it's not used in the right way. First of all, with the access to the information, it is possible that a family member or an external person can use it to control or affect the mental health and stability of the user of the product. This is why discretion must be guaranteed in the handling of this product, so that it does not create a direct affection to the person involved. In addition to, the 4 principles of bioethics were taken into account. In the first place, beneficence, since the creation of a product that can generate a good for people with GAD, to improve the feeling they have when they are immersed in an attack. Secondly, the principle of autonomy, thus allowing users to have an active participation throughout the project, since their opinion is important to us. Also, we seek the personalization of the product to attack with greater certainty and proximity to the problems of each user, since we understand that everyone is different and their symptoms vary, and therefore the solutions changes as well. Following this, the principle of non-maleficence, given that we're seeking to create a solution that generates comfort and well-being for all those who need it, without harming any person in the development of the proposal. Now, the ethical dimensions to which we resorted were respected and duly informed so that the users participating in the research felt safe, given that the information we are handling is highly confidential. Finally, we seek to structure our proposal under a dimension of social responsibility, which allow us to investigate human beings to create a proposal built with safe practices. Thus, APATCH becomes an easy and accessible alternative to provide a quick and timely solution to an anxiety attack, ensuring a sense of peace of mind to our users, with the aim of creating a safe space that ensures the welfare for them.